Cytotec is a medication that is used to prevent stomach ulcers while taking NSAIDs, such as aspirin, ibuprofen, or naproxen. This is especially important if you are at risk for developing ulcers or have a history of ulcers. Cytotec helps to decrease the risk of serious ulcer complications, such as bleeding, by protecting the stomach lining and lowering the amount of acid that comes in contact with it. It is also used in combination with another drug, mifepristone, to end a pregnancy. The daily dosage and optimal timing for taking Cytotec should be determined by your healthcare provider. When taking Cytotec to prevent stomach ulcers, it is usually taken by mouth 4 times a day, after meals, and at bedtime. If you are taking it to end a pregnancy, take it exactly as directed by your doctor. If you are using it to start labor, your healthcare professional will insert it into your vagina. It's important to avoid taking antacids that contain magnesium while using Cytotec, as they may make the diarrhea it causes worse. If needed, consult your doctor or pharmacist for alternative options. It's important to continue taking Cytotec for as long as you take NSAIDs, and to take it at the same times each day in order to get the most benefit from it. Be sure to inform your doctor if your condition lasts or gets worse. If you experience nausea or stomach cramps, be sure to let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Diarrhea is a common side effect of misoprostol and typically occurs about 2 weeks after starting the medication, lasting for about a week. It's important to stay hydrated and maintain your intake of fluids and minerals/electrolytes to prevent dehydration. If you experience ongoing diarrhea, it could lead to a significant loss of water and minerals in your body. Be sure to seek medical attention if you notice signs of dehydration and mineral imbalance, such as dizziness, decreased urination, changes in mood, muscle weakness, or irregular heartbeat. If you experience menstrual problems, irregularities, or heavy vaginal bleeding, it's important to inform your doctor immediately. While serious allergic reactions to this drug are rare, seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember to consult a healthcare professional for medical advice about side effects, and report any side effects to the appropriate regulatory authority in your country. If you suspect that you might be pregnant, do not take this medication. It can potentially end a pregnancy, cause premature birth, or lead to birth defects. In rare cases, serious complications such as uterine rupture have occurred when misoprostol was used to induce labor or terminate a pregnancy, resulting in harm to the unborn baby and the mother. The risk of uterine rupture increases as the pregnancy progresses and if there has been prior uterine surgery or multiple previous pregnancies. It is important to avoid getting pregnant while taking misoprostol and for at least 1 month or 1 completed menstrual cycle after stopping the treatment. If you do become pregnant while taking misoprostol, contact your doctor immediately. If you are pregnant, do not take this medication to reduce the risk of stomach ulcers due to aspirin or other related drugs. Additionally, if you are of childbearing age, do not use this drug to reduce the risk of ulcers from NSAIDs unless you are at high risk of having an ulcer or ulcer complications. Female patients must meet 4 requirements in order to use this drug. 1. Test negative for pregnancy within 2 weeks before starting treatment. 2. Use effective birth control to prevent pregnancy. 3. Receive oral and written warnings about the dangers of using misoprostol while of childbearing age and the risks of possible birth control failure. 4. Start taking misoprostol only on the 2nd or 3rd day of the next normal menstrual period. Remember, this medication should not be shared with others. Before taking misoprostol, make sure to let your doctor know if you are allergic to it or have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. If you have a history of stomach or intestinal disease, like inflammatory bowel disease, be sure to inform your doctor or pharmacist before using this medication. Daily use of alcohol and tobacco can increase your risk for stomach bleeding, so it's best to limit alcohol and stop smoking while taking misoprostol. You can consult your doctor or pharmacist for more information on how to do this. If you are using misoprostol in combination with mifepristone to end a pregnancy, it's important to be closely monitored by your doctor and keep your scheduled appointments to track your progress. Make sure to have clear instructions from your doctor about what to do in case of an emergency. Expect vaginal bleeding after taking the combined medicine, but contact your doctor right away if you develop any unusual symptoms such as severe or prolonged vaginal bleeding, signs of infection, like fever, chills, or fainting. Do not use this medication during pregnancy to prevent stomach ulcers, as it could harm an unborn baby. If you are of childbearing age, make sure to use effective birth control methods while taking misoprostol and for at least 1 month or one completed menstrual cycle after you stop taking it. If you become pregnant or suspect that you are pregnant, inform your doctor immediately. This medication can pass into breast milk, but it is unlikely to harm a nursing infant. It's best to consult your doctor before breastfeeding while taking misoprostol. Remember that Cytotec should be used as directed by your doctor. It is important to follow the dosage prescribed by your healthcare provider, and do not start, stop, or change the dosage without consulting your doctor first. Cytotec may interact with other medications, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Be sure to discuss any concerns or questions about drug interactions with your healthcare provider. Always take Cytotec at the recommended dosage and at the optimal timing advised by your doctor. If you believe someone has taken too much Cytotec and is showing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, severe dizziness, and slow or irregular heartbeats. This medication is used to prevent stomach ulcers while you take NSAIDs, e.g., aspirin, ibuprofen, naproxen, especially if you are at risk for developing ulcers or have a history of ulcers. Cytotec, misoprostol, is also used to decrease the risk of NSAID-induced ulcers in patients with a history of ulcers. It is also used to induce labor and to cause an abortion. If you forget to take a dose of Cytotec, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Cytotec, it's important to keep it in a dry place away from light and moisture, at or below 77 degrees Fahrenheit 25 degrees Celsius. Remember not to store it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of any leftover or expired Cytotec, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, it's best to consult your pharmacist or local waste disposal company for the proper way to discard this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.